So we've done the scan, we've shown that you've got a good number of follicles, that shows you're ready for the egg collection. So therefore, to prevent or to reduce any risk of you having ovarian hyperstimulation, we tend to use this drug called Buserelin. So there are two drugs you can use. This Buserelin, which induces ovulation, and there's also this drug called Ovitrelle, which is pre-filled, which also induces ovulation. However, though, we have tried more so to use this one because this sort of drug induces ovulation but also dampens down your hormones and therefore reduces the risk of you having any adverse reactions, namely OHSS, which is ovarian hyperstimulation.
So that one's got less side effects than this one?
It's not the drug has got side effects, it will reduce you developing ovarian hyperstimulation.
Do they both give the same results?
Usually they do. So we know that both of these drugs are timed, and when you take it 36 hours later, you go for the egg collection. And at that time, the follicles are punctured and you should get a good response. So usually we do find that patients, when they take this Buserelin, they recover quicker, if you like, from the stimulation that they've had. When you take the Ovitrelle, the drug itself contains HCG, and HCG can make your symptoms of your ovaries being enlarged stay longer in your body, if you like, and therefore can take you longer to recover. So that's a tendency, because we're grateful that you've done this for us, and we don't want to disrupt your life any further. So basically, we're trying to get you back to normality.
When you say this one will take longer to be in your system and longer to recover, in what sense of recovery is that?
In the way that you're feeling, because once you've taken what these drugs do, it makes your follicles mature and release. Now, in a natural cycle, you've only got the one follicle. So when you've been induced with these drugs, you might be growing 10 follicles or 12 follicles or sometimes 15 follicles, even 20. So it just depends on how you respond. So if you imagine your ovaries are going to be quite enlarged, so they're normally quite small. So when you have multiple follicles, your ovaries are more enlarged and more uncomfortable. Then a needle has actually gone into each follicle, punctured the follicle to get the fluid out. So that causes bruising on the ovaries. So when you take the trigger drug, it exacerbates, or it can exacerbate those symptoms. So it can make you feel more bloated, more uncomfortable. So we're trying to reduce that. And the way to reduce it, we have found, by taking this Buserelin, it dampens down your hormones a lot sooner, and therefore you're less likely to have reactions with OHSS. But again, it's down to the doctor and the clinic to decide which is the best format of treatment for you. Both of the drugs are subcutaneous, as we said earlier. This Ovitrelle is pre-filled, so it's similar to the Gernal F in that you need to attach a small needle, and again you have a small amount of medication in the pre-filled pen. In this Buserelin, you have to inject yourself with it with a small insulin type syringe, which again we tend to show you this, or how to do it, on the day when you come for your scan, that we're saying you're going to be set for the egg collection in a couple of days. So whichever medication you have, the Buserelin or the Ovitrelle, it means the egg collection usually occurs 36 hours later, so 2 days later you come back to the clinic for the actual egg collection.
Okay.
This just comes as a kit of needles. This is the needle from this bag. This Buserelin, you need to take the cap off. Take the cover off here, take this off. So the easiest thing to do is just get some air into your syringe. So it's a tiny little needle. Place that through the centre of your seal, invert it up, and inject the air inside, and pull down and fill the syringe. So again, we come slightly beneath what we need. Flick to get rid of any air bubbles, which will go up to the top. Push your surplus out, and then have your medication. Oops. This paper pen. And again, similar needle basically. Pull that off. Attach that on. Take off that cover. Take off that cover. Then you see the small needle. And then this one again, you'll do the same thing. So the gauge is on 0, you literally twist it to the very end, and it should say 250 units in the window.